Hello, I'm Michael. I'm going to be your student nurse today, okay?
Okay.
Can I just have you tell me your name, your date of birth,
Aaron Kerbal, 12/17/1986.
and what your allergies?
I don't have any.
No allergies, wonderful. So you're in here for the cancer treatment, and I understand that it's making you tired at work. How's that going?
Oh yeah, because of the chemo, I'm not able to work because I'm really fatigued and nauseous there. So.
Okay. And you had some questions maybe about going on like disability or something like that, Social Security benefits?
Yes, I have some questions about that. So I've read over the hospital's disability information packet, and I have a few questions about that.
And then what are you wondering? I can help you walk you through it. I don't work for the government or Social Security, but I can just help you with the common knowledge.
Okay. My first question is, I read I need 40 work credits to qualify for disability. What exactly does that mean?
Well, generally to qualify for disability, you need 40 work credits, 20 being earned in the last 10 years.
Okay.
So more recent work. One work credit is worth about $1,260 of income to you. And that's about 4 credits is about $5,040. In order to meet the Social Security disability insurance income benefits, you need 20 credits within the past 10 years, or $25,200 being earned before the taxes.
Okay. All right. So how long does it usually take to process the claim and receive the disability after my case is sent in?
If the case is approved, and that's a process in itself, it will take about 5 months for you to receive the disability income benefits.
Okay. Okay, so are many disability claims denied by Social Security Disability Administration?
Sadly enough, roughly 70% of new cases are denied originally by the Social Security Administration. If you continue to send in new applications after the first denial, they're just going to continue to deny them because they view that as a new case. If you're denied, you have to form an appeal, and that way a judge can go ahead and look over that case. That gives you the best chance of winning having the legal judge step in rather than just the Social Security professionals.
Okay. So I heard it's possible for disability benefits to run out. What's up with that?
Well, Social Security disability income is like an insurance policy, and every SSDI, or Social Security disability income, has a DLI, or date of last insured. That date can be interpreted as a disability benefit expiration date, actually.
Okay. If I win the case, how much will disability pay me?
That will mainly depend on how much you put into Social Security through paying taxes over the years. Social Security sends you a green printed paper periodically, and that tells you all the work information in regard to paying into Social Security. So it's what you put in you can take out after you get the disability approved.
Okay. What is the 5-step evaluation process for determining whether an individual is disabled?
The first step is Social Security determining if you can engage in substantial gainful activity. That's pretty much telling you if you can work for yourself, to support yourself. You're saying you're getting too fatigued at work, so you're pretty much clear there. If you can no longer partake in substantial gainful activity, then you can be considered for disability benefits.
Okay.
The second step is where Social Security will determine whether the claim has a medically determinable impairment or a combination of severe impairments. They're going to evaluate exactly what's wrong with you and if that fits their insurance standards. Thirdly, they will determine whether the claimant impairment meets a Social Security medical listing. So once again, you're going to look at your disability, how you're dealing with it, and how it's affecting you, and compare that to what they need from you in order to pay you disability.
Okay.
Fourth, your residual functional capacity, or your capacity to work, will be considered. You said you were too tired, so once again, they're going to go ahead and take that into account. They're going to say, well, she's not going to be too productive at her job, and that job will not support her for too long.
Okay.
Fifthly, they will consider your age, your education, and your work experience. And that way, they can be sure that you can't do the jobs your experience permits. So they won't only look at your current job, but maybe your last jobs and the degrees that you have had.
Okay.
And they're going to go ahead and evaluate that and be sure that you can't go ahead and do any of those jobs.
All right. That was a lot of information, but thank you for answering my questions there.
Oh, of course, of course. Like I said, I work with the government, but I'm just here to help you as a nurse, okay?
Alright.
Just to help you walk through it a little bit there. So are you in any pain or anything? Is there anything I can help you with?
I'm feeling a little bit of pain.
A little bit of pain? Okay, so what would you rate that on a 5 to 10?
About a 5.
Okay, and is it in your arm like it used to be or where?
Yeah, it's still around here, yeah.
Shoulder area? Okay, yeah, we can definitely take care of that. I believe you have acetaminophen on order?
Yes.
Okay, so we can go ahead and administer that?
Okay.
Okay, wonderful. Let me go ahead and we'll get some bed rails up here.
Okay.
And I gotta put your bed down too for safety.
Alright.
You'd be amazed how many times the nurses don't do this easy stuff. Let me sneak around here. And excuse me, I'll be right back with that acetaminophen, okay?
Alright. Thank you, nurse.
Of course.